Thank you for attending this presentation. I'm Kosaku Kurata from Kyushu University, Fukuoka, Japan. First of all, I'd like to thank the organizing committee for preparing for the conference in this difficult situation of COVID-19 and for giving me this opportunity. Today's my title is Application of Low-Intensity Electric Field to Cancer Treatment. I will show you a new therapy for cancer treatment by using the electric field and how we engineers can be involved in an improvement of the treatment. There are three major options for cancer treatment. Surgery that removes cancer by surgical operation, chemotherapy using drugs to kill cancer cells, and radiation therapy that uses high dose of radiation. To improve the quality of life of patients, minimally invasive treatment listed here are sometimes used, which depend on the cases. These three methods uses very high or very low temperature to kill the cells. Temperature rise higher than the protein denaturation point or repeated freezing and melting to give a damage to the cells. IRE uses a very high electric field over a few kilovolts to break down the cell membrane. In contrast, a new method using a very gentle electric field has recently been introduced, which is called Tumor-treating field, TTF. And this is what I'd like to talk about today. TTF uses a very low electric field around 1 volt per centimeter and acts on the movement of molecules inside the cells. This figure shows a cell in cell division. And as you know, a cell makes a copy of chromosomes and divides it into two cells. In this process of mitosis, the cell shape changes from a sphere to an hourglass with a neckline. Because of this neckline, electric field is concentrated and a strong dielectrophoretic force is expected to generate at the neck, which disrupts the movement of chromosomes and microtubules and inhibit the cell division. Since the cell membrane is a kind of insulator, how much of the electric field can penetrate into the cell depends on the AC frequency and the electrical properties of the cell. And this is a very important point in the TTF treatment. So, the aim of this study is to examine the effect of cell geometry and TTF parameters on the intracellular electric field by using numerical simulation. This slide shows the analytical models that we used. Two types of cell models, sphere and mitotic cell, were made and placed in the cylindrical analysis domain. An AC electric field was applied to the upper and lower surface of the cylinder. Governing equations are listed here. The distribution of the electric field potential V can be obtained by solving the equation of charge conservation law combined with Ohm's law, Maxwell's equation, and the relationship between the electric field and the electric potential. There are many analysis parameters. We examine the effect of these parameters: frequency of the electric field, cell diameter, the thickness of the cell membrane, the electrical conductivity and relative permittivity of the fluid inside the cell, outside the cell, and the cell membrane. We apply the electric field with an effective value of 2 over square root of 2, whose unit is volt per centimeter. This is one of the results of the electric field distribution. Only the frequency was changed and other parameters were fixed in this calculation. You can see the strong dependence on the frequency. In the lower frequency, the applied electric field cannot penetrate into the cells. As the frequency increased, the electric field gradually come into the cells, and at 1 gigahertz, the cells become transparent to the electric field. More importantly, inside the sphere cell, the electric field was completely uniform, while in the mitotic cells, a strong concentration of the electric field was found at the dividing plane. This slide shows the distribution of the dielectrophoretic force. I have skipped how to calculate the dielectrophoretic force, but simply it is proportional to the gradient of a square of the effective electric field as shown here. In the sphere cell, there are no dielectrophoretic force generated because of the uniform electric field. On the other hand, in the mitotic cell, a strong dielectrophoretic force was generated at the neck, but the magnitude of the force was strongly affected by the frequency of the applied voltage. In this analysis, the relative permittivity of the cell membrane was changed in addition to the frequency. So you can see as the permittivity increased, the optimal frequency giving the maximal dielectrophoretic force became lower. We extracted the value of the maximal electric field and the maximal dielectrophoretic force, which are shown in each graph. And this is the relationship between the maximal force and the frequency. And the TTF is the most effective when it is applied at the optimal frequency that is shown as a peak in this graph. But the peak moved to lower frequency when the relative permittivity of the cell membrane increased from 1 to 10. How can we use this table? Indeed, the cell diameter will increase during a TTF treatment due to cell swelling, which probably decreases the optimal frequency if our numerical simulation is correct. Previous studies also reported that the intracellular and membrane conductivities of the cancer cell is larger than that of normal cells, which causes differences of the optimal frequency and the magnitude of the dielectrophoretic force between these cells. So cell shape will change and the electrical properties have some variation. Thus, it is difficult to determine the optimal condition of the applied electric field. To improve the efficacy of the TTF treatment, we need to find a way to apply highly robust conditions of the electric field or a highly robust frequency that will not be affected by the shape and properties of the cells. This is where we engineers can contribute. Although we cannot control the properties of the cells, we may be able to change the electrical properties of the fluid outside the cells by injecting exogenous solutions to the targeted cancer. So our studies showed that it must have some effect on the magnitude of the dielectrophoretic force. So here are conclusions. Numerical simulations show that the geometry and electrical properties of the cells have a significant impact on the TTF efficiency. To improve the outcome of TTF treatment, an engineering approach to determine the optimal intensity and frequency of the applied electric field is essential. Thank you for your attention.